Okay, so welcome to this next video in which we're discussing thrombosis and antithrombotic drugs. Okay, so we are in the process of revising the hemostatic pathway so that we can later understand thrombosis and then understand how the antithrombotic drugs work. So we're revising the physiology so that we can understand the pathology and then understand the pharmacology, because it's hopeless trying to understand pharmacology if you don't understand physiology. Okay, right. So we've got to the point now where we are looking at platelet adhesion. Okay, so platelets have come in to these exposed endothelial cells. So when you've got these endothelial cells which have been damaged, okay, the endothelial cells which line the entrance to the hole in the side of the blood vessel, they have got exposed von Willebrand factor on their membranes, and platelets have a receptor for von Willebrand factor known as glycoprotein 1b95, and this means that the platelets can adhere to these disturbed endothelial cells, and you're going to get a huge number of platelets adhering to the mouth of the hole in the side of the blood vessel, basically, and this is known as platelet adhesion. Okay, so we're now going to look at the next step, which is known as platelet activation. Okay, so let's draw this picture back again. So we've got our damaged endothelial cells here, okay, where we've had platelet adhesion, as we've just discussed. Okay, so we've chopped this endothelial cell in half. Then underneath it, because it's the things that are underneath it now that we're going to discuss for platelet activation. Underneath it we have this basement membrane, which, remember, I stressed is mainly made of collagen. Underneath this we have the subendothelial connective tissue, which we've previously shown in red, which is mainly again made of collagen. So a running theme here, collagen must be important because I'm stressing it so much. Okay, and then underneath that you then have the internal elastic lamina. And then after that you'll have the smooth muscle cells, but we won't quite go that far. Okay, so basically the next process we want to look at is a process known as platelet activation. Okay? And this is going to be happening concurrently when you're getting platelet adhesion. However, it's likely that different platelets will be undergoing the activation reaction initially from the platelets which have actually adhered to the von Willebrand factor on the damaged endothelial cells. However, as we'll see, some platelets undergoing activation triggers a chain reaction where loads of platelets undergo activation. So the platelets which have adhered to the damaged endothelial cells, they will undergo activation, but it's likely that they'll undergo activation secondary to the activation of the initial platelets. So, to understand this better, let's actually look at what I mean. Okay, so when the blood starts coming out through our hole, okay, what's going to happen is that the platelets are going to meet a whole bunch of molecules and also cells which they have never ever been allowed to meet before. So remember, they usually have this very boring life of going round and round the circulatory system, and all they usually see is the other constituents of the blood and also the apical membranes of the endothelial cells. So what are these important molecules that they would never normally see and which therefore are going to activate them when they do see them? Well, one of them is collagen, okay? So when the platelets come out here, they're going to meet the edges, the damaged edges of this blood vessel. So for instance, they're going to be exposed to molecules in the basement membrane. They're going to be exposed to molecules in the subendothelial space. They're also going to be exposed to cells in these spaces, okay? So basically the collagen that is in the basement membrane and also the subendothelial space is going to activate platelets, and in addition, a molecule that is on the surface of peripheral cells is also going to activate platelets. So let me just discuss this molecule. So in the subendothelial space there will be cells, basically, the cells which are producing the connective tissue. And I realise that I have drawn this completely out of proportion. The endothelial cell is massive, and these other two layers are tiny, in my drawing at least. But of course these layers will contain cells, so the subendothelial space will be much bigger than I've drawn it here. but there will be cells in the subendothelial space. So maybe I'll show a cell here, okay? And if we take this cell out and have a look at it, then basically, on the surface of all peripheral cells, what you have is a protein, okay, on the surface membrane of these cells. And this protein is quite a famous protein, and it's known by the name of tissue factor. And it's so famous that it's also got another name. Its old name is factor 3, okay? Now, very few people would actually call tissue factor factor 3 anymore. However, when we're discussing the coagulation cascades later, you will notice that factor 3 is missing, basically, and people often ask, why is there no factor 1? Why is there no factor 2? Why is there no factor 3? And it's because factor 1, 2, and 3 are so important that they've been given other names, and we'll look at factor 1 and 2 later, but factor 3 is what is now referred to as tissue factor. Okay, so on the surface of peripheral cells you have this tissue factor. Now, importantly, tissue factor is not, I repeat, is not on the surface of cells that are circulating within the blood, so it's not on red blood cells or white blood cells, and it's certainly not on platelets. Neither is it on the apical membrane of the endothelial cells. So, basically, the constituents of the blood would never see tissue factor unless there is a hole in the side of the blood vessel. So when there is a hole in the side of the blood vessel, the platelets are suddenly going to see tissue factor all over the cells that make up the wall of this blood vessel. And of course, after the internal elastic lamina, you've got the smooth muscle cells over here, and they'll be covered in tissue factor as well. So here's our smooth muscle cell. Okay, so the platelets are going to see these two things, collagen and tissue factor, and both of these things are going to activate the platelets. So they have receptors for both of these, and they will lead to platelet activation. So what is platelet activation? Well, let's draw our little platelets here. So this is very important because in later when we continue the process of hemostasis, I will often say, in an offhand way, I'll say things like, this activates the GP2B/3A receptor. However, I do not mean that that is platelet activation. Strictly speaking, platelet activation as a name, okay, means the process that I'm about to describe to you. However, obviously the word activate is often used just as a word. It's not used as a name of something. But now, this actually is a name given to a process. So, strictly speaking, platelet activation means exactly what I'm going to tell you now. It means that the cell starts chucking out two molecules. Okay, so the platelet starts producing two molecules. That is the process of platelet activation. Now, what are these two molecules? Well, one of them is ADP, adenosine diphosphate, okay, and the other is thromboxane A2. Okay, now I hope you're familiar with ADP, but thromboxane A2 you might be less familiar with, so I think I should probably write out its full name for you. Thromboxane A2. And we will discuss this much more later. We'll discuss the process by which the thromboxane A2 is actually made within the platelets later, because, importantly, the antithrombotic drug known as aspirin, just a little, niche drug, the drug aspirin works by blocking the production of thromboxane A2, so we'll look at how the platelet is actually going to create it later. Okay, when the platelet is activated by either collagen or tissue factor, it starts producing thromboxane A2 and also adenosine diphosphate and chucking them out into the surroundings. Okay, now we'll start with ADP because it's simpler than thromboxane A2. So ADP is going to be involved in this cascade, basically, this chain reaction. Okay, so ADP will go to other platelets, okay, which haven't yet seen collagen or tissue factor, so this platelet is currently not activated, but this platelet has on its surface a receptor, okay, known as the ADP receptor. So this is the ADP receptor. Okay, right. Let me colour this in. So I'm going to colour the ADP receptor in purple here. Okay. Now, basically, when ADP binds to the ADP receptor, that causes this platelet here to undergo the activation response. So it will also undergo platelet activation. So basically, some of the platelets will be lucky enough to actually meet collagen or tissue factor, and they will be the first ones to undergo activation. So the ones which actually meet some collagen or some tissue factor, they will be the first to undergo activation, and they'll start chucking out ADP and thromboxane A2. However, the ADP will go back and recruit more troops, basically. So it's like the platelets have found an alarm signal, and now they're sending a message to tell other platelets, look, we've got a problem here, you better come and help. Okay, so the ADP then comes and activates other platelets which weren't actually aware of the collagen and the tissue factor, but now they're going to be induced to undergo the activation process too. And they will again release thromboxane A2 and ADP. Okay, so I'd just like to mention one of the antithrombotic drugs now. We'll go over its name again later when we go over all of the antithrombotic drugs, but one of them fits so nicely into this pathway that I'm going to mention it now. So one of them is a drug known as clopidogrel, okay, and I will mention this later so that when I discuss the antithrombotic drugs my discussion is complete. But clopidogrel works by binding to the ADP receptor and stopping ADP from being able to bind to it. So it's a competitive antagonist for the ADP receptor. It will bind in the ADP binding site and stop the ADP from being able to bind. So effectively it stops this recruitment of more platelets, it stops the chain reaction, okay? So only the platelets which actually find the collagen and the tissue factor will now actually be activated, and you won't get the secondary activation via the ADP receptor. So the number you'll get activated now will be feeble, basically, because the chain reaction is so important. And I should say this is a chain reaction, so now the ADP that's been released from this second platelet will go off and activate more platelets, so it's a great chain reaction basically. But if you block the ADP receptor, then you're going to stop ADP from being able to activate other platelets, and therefore you're going to stop the chain reaction. So the number of platelets that actually become activated will only be the number which actually saw collagen or tissue factor, which is feeble basically. So this stops platelet aggregation, and that's going to actually lead to an antithrombotic effect, as we'll see in a moment. Okay, so clopidogrel is a very important antithrombotic drug. If you go into your local chemist, and if you have to wait for a while, have a look at the drugs on the display behind her, okay, or him, basically you will find clopidogrel somewhere, because it's a very commonly prescribed drug nowadays. I mean, I went into Boots a while ago and I saw clopidogrel, and without too much looking you'll see clopidogrel somewhere. Okay, so right then, so what was the point of this platelet activation? Well, ADP is just there to produce the chain reaction, and it's very important because if you block it with clopidogrel you have a fantastic antithrombotic effect. But it must be the thromboxane A2 which therefore is important, because that's the only other product of this activation, and indeed it is. So basically, when you get this chain reaction of platelets becoming activated, you're producing a huge amount of thromboxane A2 in the vicinity of this cut, okay? So, let me illustrate this by putting on orange dots to represent the thromboxane A2. So, we'll highlight thromboxane A2 in orange. So basically, in the vicinity of this cut, you will get absolutely loads of thromboxane A2 being produced. Now, what is the effect of producing all of this thromboxane A2? Well, basically, it has two effects, okay? So we'll start off with the first portion of hemostasis. So hemostasis as a process is often divided into 3 effects that you are going to produce, okay? And the first one is going to be produced by thromboxane A2, and also the second one is as well. So what does thromboxane A2 actually cause? Well, it's going to cause vasoconstriction. It's going to activate the smooth muscle cells in the vicinity of this hole in the side of the blood vessel wall to contract, and we've already discussed that when the smooth muscle cells contract, they're going to decrease their length, and since the smooth muscle cells are arranged in those rings around the lumen of the blood vessel, when they all contract, the circumference of that ring goes down, and therefore the diameter goes down, and that will transfer to a reduction in the diameter of the blood vessel. So basically, what it's going to produce is, if we have our blood vessel here, with the hole in the side of the wall here, okay, then what's going to happen is that the lumen of the blood vessel is going to constrict. So you're going to go from this scenario to this scenario here. Okay, so you've still got the hole, and I'm sorry, I've drawn the hole as though it's a little bit smaller. That's wrong. Imagine that the hole is the same size as in that original picture, but now the lumen of the blood vessel is really narrow because all of the smooth muscle cells have contracted. Okay, now loads of blood will be conducted through this wide lumen, but now with this really narrow lumen, and don't worry, I'll highlight it in red so it's easier on the eye. With this really narrow lumen, hardly any blood is going to be conducted through there. So the amount of blood that you're going to conduct to this hole, and therefore the amount of blood that can leave the blood vessel through the hole, is going to be markedly decreased. Okay, and vasoconstriction is considered the first portion of hemostasis. Okay, so you constrict the blood vessel that's leading up to the hole, and therefore reduce the amount of blood that is coming out. And remember, the definition of hemostasis is just a pathway to stop bleeding, to stop hemorrhage. So this is a very important part of that pathway to stop hemorrhage. And it's caused by the platelets becoming activated when they find the hole in the side of the blood vessel, setting off a chain reaction of activation which leads to thromboxane A2 being produced by all of the platelets in the vicinity of this hole, and this thromboxane A2 then leads to the vasoconstriction. Okay, now the thromboxane A2 is also actually going to activate platelet aggregation, but before we see that, we'll have a break. So, in the next video.